We're glad you're back. The Sisters by Choice organization has unveiled a clinic on wheels to help women in underserved areas get the life-saving treatments they need. Here's more about it. The chance of a woman developing invasive breast cancer in her lifetime is 1 in 8. That's according to the American Cancer Society. One Metro Atlanta doctor is working to change those numbers, and she's trying to help women live longer by finding that breast cancer early.
There were so many women who did not have insurance.
Dr. Roxbert Phillips-Reed is a nationally recognized breast surgeon.
You've never had a mammogram.
Who's been looking for ways to help women stay alive after they're diagnosed with breast cancer.
We all feel that breast cancer happens to somebody else. It's not going to happen to us. But when it gets close to home, when you have a friend or a mother or a father diagnosed with breast cancer, it hits home. Breast cancer can impact any one of us.
After decades of fundraising and educating through her organization, Sisters by Choice, Dr. Phillips-Reed is unveiling the first mobile unit of its kind in Georgia dedicated to diagnosing and treating breast cancer.
This is the first specialty clinic, breast clinic of its kind, to my knowledge, okay? And what we have to do is we have to really develop some systems and roll it out slowly. My hope is between now and 6 to 8 months, we will be slowly getting in full gear.
And Dr. Phillips-Reed says the mobile clinic won't just be on the road during the month of October, but expect to see it 365 days a year. If you know someone who has a lump or is in need of a mammogram and has no insurance, they should call Sisters by Choice. We've got a link for you on CBS46.com. Once again, we've got an expert with us to talk a little bit more about ways to manage breast cancer and some of the misconceptions we've had out there. Dr. Sheldon Linsenberg, thank you so much again. Now, keys to beating it. We've talked about early detection being one of the major things women can do. But a lot of women choose, as we kind of touched on, even if they have no breast history, but if their parents do or a sister does, doing a mastectomy, double mastectomy, and perhaps some other things to keep the cancer away. How common is that now?
Well, it's becoming more common because we're detecting genes in the family members that imply the cancer is going to move into the next generation. And the more genes we detect and the more ways we know that they work, the more likely women are becoming fearful of developing breast cancer and not being able to cure it.
Now, you're a dad with 4 girls.
Yes, I am.
How do you talk to them about this, with this being, you know, what you do every day?
Fortunately, we don't have breast cancer in our family, but that does not mean that they can't develop a breast cancer without the gene being in the family. So we talk about self-examination, mammography, and staying in touch with all of their friends so that they know how they deal with it.
And there was a little debate early on about what age women should get mammograms. What do you suggest as far as patients and women, if they have maybe family history even?
A couple of years ago, the Cancer Society and a couple of other organizations felt that diagnostic mammograms weren't valuable at the age of 40, that it wasn't going to change the quality of life or the length of life. And they started to recommend a later onset for mammograms. That seems to have peaked and regressed to some degree. So I still tell my patients, at this point, when they reach 40, they need a mammogram. However, if there is breast cancer or breast disease in their breasts, they should start earlier, like 30 or 35.
The fibrocystic that Paula talked about.
Yes.
That's an issue as well. And we're looking at the 3D mammograms. They're supposed to be better and see more things. What do you see through these?
I don't know enough about the 3D mammograms to comment on that.
Okay, but they look like they've really changed the way doctors are able to, the other oncologists are able to treat and find the breast cancer in so many patients. And when you look at this, we talk so much about women and breast cancer. Men can get breast cancer as well.
That's true. The numbers are about 2,000 cases of breast cancer in men in this country every year.
And folks don't even believe that, so men should be checking as well. I know a friend whose mother and father had breast cancer, so she chose to do the bilateral mastectomy and make sure that her chances were going to be lowered. That actually works, huh?
It does. And what you can do for yourself is to detect a breast lump, or in men, a chest lump, as early as possible. That's what's going to give you a higher chance of beating the disease.
You actually see women patients who really have a hard time through this, so you decided a couple years ago to do something very special. Let's talk about that, to bring a highlight to this, a whole thing. A big luncheon that you have?
Yes, we raise money annually for 2 local beneficiaries every year. We've been doing this for 20 years, and we're very proud of the work that we do and the way that the monies that are raised by all the people that attend in our community.
Talk about this. This year, this was the event, and the 2 organizations, there's one of the recipients, Danielle Beverly. Talk about her organization.
Yes, Danielle is part of the Eric R. Beverly Family Foundation, and they have an angel fund that supports women that have breast cancer, that need to be able to get to their chemotherapy appointment, that need to have after-school care for their child so they can come and have their radiation or their treatments, or that need a mammogram.
Fabulous. I've done work with her, and she's a breast cancer survivor. And quickly, the other organization that received funding?
The other organization is the Georgia chapter of the National Breast Cancer Coalition. For many years, they've been involved in educating women in Georgia about how to detect breast cancer. They also have an annual trip to Washington, D.C. on Breast Cancer Day to meet with all of our representatives and senators to let them know how we feel about the issues that are in front of them, that confront them, that deal with breast cancer.
Dr. Litzenberg, thank you so much. Appreciate your time. Stay with us. We're going to be right back to wrap this all up after the break.